If your quest for longevity feels overwhelming, here's some good news. It starts with one simple daily habit. MitoPure gummies from Timeline. They're the first ever longevity gummies that ignite mitophagy, your body's natural anti-aging pathway. MitoPure is a clinically validated solution backed by over 15 years of research. MitoPure gummies utilize a powerful compound that redefines what's possible for your longevity. MitoPure produces the first ever urolithin A gummies that support your cellular energy so you feel strong, clear, and vibrant. Boost your cellular energy and enhance muscle strength and endurance, all without changing your diet or exercise routine. As someone who loves to stay active, I've noticed a significant boost in my workouts since I started using it. I feel stronger and more energized, and my recovery time has improved dramatically. Better recovery starts at the cellular level. For more information and to order, just go to timeline.com/Hoffman. Use coupon code Hoffman at checkout for 20% off. That's timeline.com/Hoffman for 20% off MitoPure gummies with code Hoffman. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. We're talking about nitric oxide. And I just want to mention we are have a special offer for Intelligent Medicine listeners. We're talking about the product N101. And if you want to try it, visit HoffmanNO.com. That's HoffmanNO.com. Our guest today is the developer of N101. He's Dr. Nathan Bryan, who is a nitric oxide expert. In fact, he lectures all over the world, has written texts and numerous articles on the subject of nitric oxide chemistry. In part one, we talked about the health benefits of nitric oxide. Beet juice, yeah, okay. It's a little grody. I don't think that that's going to work for a lot of people, especially before an athletic event. It kind of sloshes around in your stomach and you get a stitch in your side, and that's no fun. So that is, in fact, a net negative on athletic performance. But I have a question for you, because we're talking about dietary nitrites and nitrates. Now, there's this whole thing about when you buy bacon, you're supposed to buy nitrite-free bacon, okay? That's a thing. It's been going on for a long time. The thought is that these nitrates are carcinogenic, that they form dangerous nitrosamines. But on the other hand, they do support nitric oxide biochemistry. So please explain to me, like I'm in the 6th grade, why, if I want to boost my nitric oxide, why can't I just eat a lot of nitrite-laced bacon and Oscar Mayer bologna and get all the nitrites that I need from these processed foods?
Well, no, it's a great question, Dr. Hoffman, and it comes back to what we just discussed in the previous segment. The numbers don't work. The numbers, because you have to understand that nitrite is a curing agent. So it binds to the iron of myoglobin. It prevents foodborne pathogens, and it creates this cured meat.
But it also makes it look pink and not gray, because it's really unappealing. The gray bacon, but you want that bright red color.
No, that's exactly right. That's what nitrite does. It forms nitric oxide, and the nitric oxide binds to the heme iron of myoglobin and creates that nice pink color. It's called a nitrosyl home pigment. But nitrite is absolutely essential for food safety, because without it, you get overgrowth of Clostridium, other foodborne pathogens, and people would get sick from it. But here's the thing, is that we had an accelerant to the meat industry added an accelerant called ascorbic acid or vitamin C. Now they use erythrobate, but that it facilitates the reduction of nitrite to nitric oxide. So the chemistry is very well defined, but the point is there's no residual nitrite left in bacon or cured meats or lunch meats. It's all reacted, and that's why you won't get a benefit from that by eating bacon or sausage or lunch meat, because
but you also won't get the dangerous nitrosamines, right?
No, that's exactly right. And so that whole kind of concept or hypothesis started back in the 1950s. And then to prevent any nitrosamine formation, that's when I think 1972, the Code of Federal Regulation changed, and it required for you to add erythrobate or ascorbic acid to any nitrite cured meat.
Okay.
Because it prevents nitrosative chemistry, it accelerates the formation of the curing process, but there's no nitrosamines in any cured meats anymore.
Okay.
There's zero. It's been detected. We've even analyzed it, and we published on this I believe in 2015. And the other thing is, if nitrite and nitrate were carcinogens, then vegetarians would have 10 times higher rates of cancer than meat eaters, because 85% of the nitrite and nitrate we get from our diet comes from green leafy vegetables.
Right.
Only 5% comes from cured and processed meats.
So not just beets, but like arugula, I understand, is very high in dietary nitrates.
Yeah, typically the darker the green vegetable, the higher the nitrate content, because it's the nitrate from the soil. And that's why when you fertilize the grass, it becomes darker green. And so same thing with the vegetables. The darker the green, typically the higher the nitrate content.
Okay, so fast forward to a supplement. You're, from what I understand, you're not using beet concentrates in your lozenges, or there's also a sports drink that you make, which actually has the name No Beets. That's what you call it. No Beets. And it's a white powder that I sometimes use, in a spin class to give me kind of a nitric oxide boost. So without revealing any proprietary information, because I think there's a bit of a secret sauce here, how do you achieve nitric oxide delivery in a small lozenge as opposed to having like teaspoons and teaspoons of beet powder?
Well, I'll take you through the process. And look, everything we've done has been published in the scientific literature. There is no secret sauce. We're completely transparent. But I developed the lozenge because you have to understand nitric oxide is a gas that's gone in less than a second. So how do you safely and effectively deliver a gas in a shelf-stable product? And this was my intent to develop drug therapy. So what I had to do was create a matrix that we put these components together. And when these two components come together, and it's usually a physiological amount of sodium nitrite with magnesium ascorbate, which is an electron donor and what we call an accelerant, that produces nitric oxide gas. So I make this lozenge, you put it in your mouth, it slowly dissolves. I want it to dissolve over 5 to 7 minutes. But as it's dissolving, we're making nitric oxide gas, because we know that most people aren't making enough of this gas, so we've got to provide it for you. And so it's like, if you're low in testosterone, we give you testosterone. Women are low in estrogen, we give you estrogen. If you're low in nitric oxide, we give you nitric oxide. We don't give you beet powder or arginine or citrulline and hope your body can make it, because that's the reason you're low. You can't make it. So that was the first technology. It's a solid dose form of nitric oxide gas. But then, because of all the media and the advertising and these companies selling beet products out there that didn't work, I almost felt like I had an obligation and a duty that if people are looking for beets as a source of nitric oxide, then we know how to do that. So what I do is I ferment the beets. So I take a high nitrate beet product and then I ferment it, because nitrate is inert in humans. And if you don't have the right oral bacteria, which most people don't, then you can take these beet powders and drink beets, but you're just going to excrete it in the urine, the feces, and the sweat.
I've heard that if you take a strong mouthwash, like a disinfectant mouthwash like Listerine, you can actually abolish a high percentage of your nitric oxide synthesis because of the getting rid of the beneficial bacteria that create that conversion.
For sure. We and others published on that probably 20 years ago. That if you take normal intensive patients, people with normal blood pressure, and you put them on an antiseptic mouthwash, their blood pressure goes up.
Wow.
And their blood pressure goes up because it's destroying the good bacteria in their mouth that are producing nitric oxide. And without nitric oxide, the blood vessels become constricted and your pressure goes up.
Wow.
And we've now ascribed this to resistant hypertension. People who have resistant hypertension, which, as a physician, if you have high blood pressure and they put you on an antihypertensive medication, 50% of the people don't respond with good blood pressure management.
Exactly.
And these are usually ACE inhibitors, ARBs, or calcium channel blockers. And so what we're finding is they're resistant to that type of therapy because it's not the basis of their hypertension. The basis of their hypertension is oral dysbiosis, because they're using fluoride-based toothpaste, which is an antiseptic, and they're killing the good bacteria. So if we target now the oral bacteria and prevent the destruction of it, we can optimize nitric oxide production and we can normalize blood pressure.
Wow. So what I understand is that vitamin B12 plays a bit of a role in this, because nitric oxide is one of those Goldilocks things. You actually want, this is my rudimentary understanding, you actually want nitric oxide production, but you don't want runaway nitric oxide production. And B12, especially the methylcobalamin form of B12, kind of acts as a scavenger to prevent the adverse downstream effects of nitric oxide overproduction?
It can. There's so many cofactors and substrates that's required for nitric oxide production. And then so it's not just on the production side, but also on the post-production and scavenging.
Okay.
So when nitric oxide is produced, it's a gas, so it diffuses in 3 dimensions and it binds to metals. And cobalamin or B12 has a cobalt. It's a metal.
Okay.
So it can bind to that, and then it can re-release it. And then so what we worry about, as you mentioned, in chronic inflammation, where we get an upregulation of what we call an inducible isoform of nitric oxide synthase. So it's producing a lot of nitric oxide gas in a local environment of inflammation, but it's shutting down a lot of the constitutive production of nitric oxide. And then it's overwhelming and binding to these metals and disabling a lot of other enzymes. So what we have to do is maintain proper regulation. And it's a very complex system, but we understand what's required for synthesis and for maintaining normal metabolic flux and activity. So when nitric oxide is produced, we want to know, where does it go, what does it become, and how does it signal? And when you're inflamed, you lose that regulation. But there are many things, and it's not just B12, but it's cell-free iron, it's elevation in ferritin, and it's things like oxygen radicals and many other things. But it's a complex system. But I spent the past 25, 30 years trying to understand the metabolism of nitric oxide, and once it's produced, where does it go, what does it become, and how does it signal? And that's what we try to recapitulate in our product technology. I never want to give the body something that it's not used to seeing, and I want to deliver nitric oxide at normal levels and flux that the body would normally produce.
Okay. So there's other interesting use cases for this. In addition to the obvious cardiovascular benefits, there are some medical conditions where nitric oxide seems to be especially crucial. And one of them that you talk about in a paper that you've helped produce for us, it's available at drhoffman.com, glaucoma, increased intraocular pressure, but also kind of a neurodegenerative process that occurs. It's not just about pressure in the eye.
Yep. Yeah, so what we're finding is, look, it's regulation of circulation and blood flow. And so what we look at in heart disease and things, these are, the coronary arteries are relatively large arteries, they're conduit arteries. And so we look at flow through the kind of resistance or conduit arteries. But the problem in like macrovascular disease, whether it's macular degeneration, whether it's glaucoma, or even in what's called ischemic non-obstructive coronary artery disease, was the regulation of the small blood vessels. And so the example uses glaucoma. So it's an inflow-outflow issue. So it's a loss of regulation of blood flow. And so again, if you have small blood vessels, you got the same volume of blood going through smaller blood vessels, pressure goes up. That's simple physics. Pressure equals volume times resistance. The volume doesn't change, but the resistance goes up because the blood vessels can't dilate, then pressure goes up. And that's glaucoma. So when we give nitric oxide, we're making the blood vessels more responsive, more reactive. So we match the inflow with the outflow, and then we normalize pressure. And then look at things like diabetic retinopathy or macular degeneration. Again, it's a microvascular issue that when you give nitric oxide, you maintain perfusion, regulation, vasodilation, improvement in the red blood cell deformability so they can better transit the small blood vessels and more efficiently deliver oxygen. So it doesn't matter what condition you're looking at, it's all about regulation of blood flow and oxygen delivery and mitochondrial function.
You say you're doing studies. So what are some of your studies showing that validate, A, that you're actually delivering nitric oxide, and B, that is having a clinical benefit in a condition, say, like hypertension, or, where you can actually measure the endpoints?
Yeah, well, look, that's coming from academia, spending 25 years in academia. I'm trained to go through the rigor of like if we were doing drug discovery. So number one, I want to demonstrate.
So you don't have to outsource studies. You don't have to pay an outside lab to conduct studies on your behalf because you are a trialist. You are a trialist yourself. You're trained and you know the ins and outs of how to put together a study.
No, that's exactly right. I've published over 100 peer-reviewed scientific papers. Dozens of published, randomized, placebo-controlled clinical trials. So I know how to do this. What I like to do, I can certainly have the capability to do this, but I'm conflicted.
Okay.
Right? And people like to see uninterested third-party validation.
Okay, I hear that.
Of that.
I hear that.
And so what I do is if your body's not making nitric oxide, then I have a nitric oxide gas phase analyzer. I can demonstrate and validate that our products produce nitric oxide. And there's no other product technology out there that does that. Then number two, is it vasoactive? When we give you the product, does it have a biological response?
Mm-hmm.
So the easiest thing is to take an ultrasound and put it on your carotid artery, and then take the lozenge, and you can actually see through an ultrasound probe the blood vessels dilating.
Mm-hmm.
So we're opening up the circulation. And then we do functional measurements of how functional is the enzyme in the lining of the blood vessels. So within 20 minutes of taking the lozenge, we see about a 20 to 30%, sometimes 50% improvement in the body's ability to make nitric oxide on its own. And then we do tongue scrapings. We culture the bacteria. Have we improved the bacteria that are responsible for the production of nitric oxide? And then we measure blood pressure, 20 minutes, 60 minutes, 4 hours later. Have we normalized blood pressure, bring blood pressure down if it's elevated?
Sure, you're looking at FMD, flow-mediated dilation, it's called. Yeah.
That's exactly right. And then we draw blood, and we see a 27% reduction in triglycerides after 30 days. We see about a 35% improvement in C-reactive protein in patients have an elevation in CRP. We see increase in stem cells in circulation after a period of a couple of weeks. We can see improvements in renal function, kidney function, preventing protein spilling in the urine. We can see reversal of heart disease within 6 months. All of these are clinically validated and published in the peer-reviewed literature of what our products do. So everything that we do, we validate clinically relevant endpoints. We don't cite third-party studies of an ingredient we put in our product and call it good.
That's sometimes done. Yeah.
Yeah, and that's what most of these companies are doing.
Yeah, well, they will, and sometimes they'll take, a study will show that, 6 grams per day of something really works great. And then they'll put, 250 milligrams into their product, and they'll kind of draft off the success of studies where the dosages used were astronomically higher.
Now, look, that's the game dietary supplement companies play, is that they mess with the dose. It's not an effective dose. Or the best example is grapeseed extract that they put now in a gummy or a chew and put sugar in it. And so it can't even activate the receptors because sugar's bound to it because it's now in a gummy or a chew.
Not a big fan.
But they're saying, this grapeseed extract has been shown to improve endothelial function and all this fancy French grapes and all this that they're advertising on TV. It doesn't work because it can't work. But yet that's the game these companies play, and they're spending tens of millions of dollars in advertising and making hundreds of millions of dollars a year off the naivety of consumers that really don't have the skill or the know-how to interpret these data. They just take it for the truth because they see it advertised on TV.
Yeah, it must be disappointing to you to see some of the excesses and exaggerated claims of companies that you really ignore the science. It's almost like kind of a reverse merit system, isn't it, when it comes to supplement quality?
Yeah, no, look, I tell people all the time, the companies who spend the most money on marketing and advertising are typically the people with the least science.
Yeah.
Because if you develop a good product, and here's what my experience is it may be a slower build, but you have to tell the truth, and you have to develop products that actually work. It's based on real science. And when you do that, and I think you can attest to this, that when you take a product, you feel the difference, and you feel it. So when people buy our products, they continue to take our products because it's providing benefit. Some people may feel it, but we can demonstrate clinically that it's moving the needle. And you may not feel your blood vessels dilating, but we know every single person who takes our product, we're dilating their blood vessels. We've measured this in hundreds, probably thousands of people through FMD, through changes in blood pressure, through ultrasound, through functional MRIs or SPECT scans, and changes in sexual function and performance.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up. If your quest for longevity feels overwhelming, here's some good news. It starts with one simple daily habit. MitoPure gummies from Timeline. They're the first ever longevity gummies that ignite mitophagy, your body's natural anti-aging pathway. MitoPure is a clinically validated solution backed by over 15 years of research. MitoPure gummies utilize a powerful compound that redefines what's possible for your longevity. MitoPure produces the first ever urolithin A gummies that support your cellular energy so you feel strong, clear, and vibrant. Boost your cellular energy and enhance muscle strength and endurance, all without changing your diet or exercise routine. As someone who loves to stay active, I've noticed a significant boost in my workouts since I started using it. I feel stronger and more energized, and my recovery time has improved dramatically. Better recovery starts at the cellular level. For more information and to order, just go to timeline.com/Hoffman. Use coupon code Hoffman at checkout for 20% off. That's timeline.com/Hoffman for 20% off MitoPure gummies with code Hoffman.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear Nasal Spray is available at retailers nationwide and online. Check out Xlear.com for our special offers. That's Xlear.com.
Thanks for listening, and thanks for supporting our sponsors. They, of course, are what make intelligent medicine continuing free resource to you. And now back to today's guest, nitric oxide expert, Dr. Nathan Bryan. Are any sports teams utilizing your products? Because sometimes you will either offer those products or even sometimes sponsor teams to use the products.
Yeah, from my discoveries from 25 years ago and through patent license from company, we've got, most every professional and collegiate sports team uses a form of my nitric oxide product that I developed years ago because they understand how important nitric oxide is for their performance. But yeah, it's a product that actually works because it's based on real science.
Mm-hmm. Okay, so this definitely, there's some uptake in the sports world, and this is legal. This is not, WADA, the World Anti-Doping Association, prohibits the use of certain products, but certain things, natural things, like a little caffeine, some dietary nitrates, these are things that are legal. So I have a personal question, which is I take this stuff before workouts. And so it's a question of timing. I sometimes notice that, swimming is a thing I do a lot these days because it's, it's easier on the joints and, I can get a good workout. I can sustain a swim for, 45, 50, 55 minutes. But I notice that sometimes I'll take the lozenge, right? Sometimes it's like one of those going out the door things, like, oh, I forgot to take the lozenge, go back in, take the lozenge, and it dissolves in my mouth. And literally I'll get in the pool and I go, I'm not feeling it today. I might just do half a workout. And then I get through about half my workout and I go, yeah, I think I can go for that full workout. I can do that full, 80 laps, the 2,000 yard swim, because it's kicking in. So what's the timing on this? Is it virtually instantaneous because you say, sublingual, that's a rapid delivery system and you get the nitric oxide absorption very quickly? Or is there a latency period? Should you take it an hour or two before workout? How does that work?
No, look, it's a very good question. And this is all based on pharmacokinetics and pharmacodynamics of how the nitric oxide is released, how it's absorbed, and how it affects, the tissue and specifically the heart and the skeletal muscle, especially during a workout. But because what we do is producing nitric oxide gas, whether it's the beet powder or the lozenge, as soon as you put it in your mouth, it's producing nitric oxide gas. And then nitric oxide is absorbed buccally, and you swallow your saliva, it's absorbed in the lumen of the stomach. But we see peak plasma concentrations after about 20 to 30 minutes. Now, how does that correlate to performance? We've never done that study, but you don't have to wait 90 minutes like you would a beet powder or some other for allow for the absorption, the reuptake in the kidneys, the concentration of salivary glands and all that. You don't need that. So probably, I would say 15 to 20 minutes. Me personally, I work out in the mornings as soon as I wake up. So as soon as I wake up, I'll take the beets powder because it's got electrolytes and ATP in it. And usually by the time I take that and get ready and start working out, it's 10, 15 minutes. But by that time, I know my peak plasma concentration is, I've reached peak plasma levels, and you just get a great workout. And so I notice the difference when I don't take it. And so I
Yep.
typically do the same type
Yep.
of regimen, and I go, wow, this seems a little bit more cumbersome today, or the
Yeah.
perceived exertion appears a little bit greater
Is there any impact
when
on
I don't take it.
is there any impact on recovery? Because that's a limitation. It's not just, in the, having the endurance and energy to get through a workout. It's, after hard workouts and, especially strength training workouts, but often long distance, aerobic workouts, you get sore. Is there any evidence that nitric oxide has impact on recovery time?
Yes, for sure. I mean, there's lots of published data on that, and physiologically it makes sense, because if you don't have adequate nitric oxide production, you're not at peak performance, and then you start to get into this anaerobic metabolism.
It's like a deficit. It's like a deficit that you.
It's a deficit.
Yeah.
Yeah.
There's a debt that you create.
Yeah. So what we look at is production versus consumption. So in well-trained athletes, you're producing a lot of nitric oxide, but then you're consuming it, right? So when the consumption outpaces the production, because you've reached that anaerobic threshold, or you're really pushing yourself, then that's where the deficit occurs, and you start to metabolize lactic acid, and that's the soreness.
Okay.
So nitric oxide prevents lactic acid production, but furthermore, it's mobilizing stem cells. So now you're going to repair and recover and replace dysfunctional cells more efficiently. And then you're going to get a better adaptive response, because part of the benefits of adaptive training or resistance training is giving your body the ability to adapt to that challenge, that we call it hormesis. So these brief periods of insult or ischemia or hypoxia adapt the body to make more blood vessels, to make the blood vessels more responsive, dilate, so that they can improve ATP production, improve mitochondrial biogenesis. And that's the benefits of exercise training. It's adaptation to that brief periods of insult.
Yeah, it's hormesis. It's a stress that the body then responds to, and then there's a recovery and a buildup and building resilience and building foundation. I wanted to ask about optimal dosing, because there are people out there who are saying, well, I have high blood pressure, I'd like to try it. If I think the recommended dose of the lozenges is 1 twice daily, is that correct? But if somebody says, well, I got really bad high blood pressure, I'm going to take 6 of these things. Could they run into trouble? I mean, or, is there...
Well, dose dictates poison. I mean, you can consume too much water, and it happens. Yep. People die from hypotonic lysis from drinking too much water at one time.
Yeah.
So what we worry about in nitric oxide toxicity is low blood pressure, hypotension. So you get systemic vasodilation, and you lose perfusion pressure.
Right.
May get lightheaded, syncope, and may pass it.
That happens sometimes when people take nitroglycerin, which is a nitric oxide, old-fashioned drug, and also, by the way, often taken sublingually, works real fast. If you're having angina, if you're on the cusp of having a heart attack, like in the old movies, they're like, people grasping for their bottle of nitroglycerin, and then the murderer kicks it away, and like Agatha Christie.
Yeah. No, and then same thing. You get dilation, and you lose perfusion pressure, and you may get lightheaded and pass.
Yeah.
Then the other one is methemoglobinemia, which we've never seen it clinically, but it's basically too much nitric oxide oxidizes the heme iron of hemoglobin, and it becomes cyanotic, and you lose the ability to deliver oxygen. But here's what we know. And so what I tell people is, in dietary supplements, obviously we're not out there preventing, curing any type of disease like hypertension. But again, everything we do, we've published on. And so the safety study, the case report that I report on, is a 15-year-old kid who had resistant hypertension. We treated him at Texas Children's Hospital, and we published this in the American Journal of Hemogenetics in 2011. But he had severe resistant hypertension.
I'm sorry? Oh, okay, hypertension.
It's a condition. Well, he has a condition called arginosuccinic aciduria. It's a rare genetic disorder. It's a urea cycle disorder.
Right.
But one of the consequences of that is they develop really high blood pressure. And his blood pressure was 210/115 in the intensive care unit, the pediatric intensive care unit. And we dosed him with our lozenge, and within 4 hours, his blood pressure came down to 130/80.
Wow.
And so for him to maintain that pressure, again, 210/115 to 130/80 with one lozenge. And then we had to dose him every 4 hours to maintain
Mhm.
kind of an adequate, healthy blood pressure. So we know, and we monitor him for unsafe drop in blood pressure. We
But
monitor
that's
him for
that's
hemoglobin
a unique case of a metabolic disorder where there's a
for sure.
inefficient metabolism of that pathway.
Yeah, no, absolutely. But the reason I bring that up is
Yeah.
because we know in a 15-year-old, 160-pound kid that one lozenge every 4 hours
Hmm.
is completely safe.
Okay.
So what I tell people, if you want to try to maintain healthy blood vessels and
Hmm.
support healthy blood pressure, you can take up to one lozenge every 4 hours and monitor your blood pressure, and I'm completely confident that there's no safety issues.
Hmm.
But then blood pressure is easy. You just titrate into effect.
Right.
You dose to effect.
And then, in cooperation with your physician, if it's effective,
Absolutely.
you want to uh, reduce your blood pressure medication dosage, or eventually, hopefully the prospect is there for eliminating or weaning off of a medication, uh, and preferentially using a natural product that treats the origin of the problem. That
That's right.
Yeah. So
Yeah, that's our goal. That's our goal, is to get to understand the mechanism of disease to the extent that you can eliminate drug therapy. Give the body what it needs, remove from the body what it doesn't need, and let the body heal itself.
Indeed. All right. Okay. So you briefly mentioned arginine. And so for a long time, we've been told that the way to jack your nitric oxide production is to take a lot of arginine, but turns out you need to take a fair amount. You need to take, like, I think 6 grams, according to some studies, which again is a couple of teaspoons of arginine. That would be, well, like 500 milligram capsules. So you need 12 capsules of arginine to have that effect. They also sometimes combine it with citrulline, which is in that synthesis pathway.
Yep.
And actually some products that are being sold for ED, natural ED products, contain arginine and citrulline. Is that plausible? Is that, a kind of a part of an all of the above approach to nitric oxide support, or is that the wrong way to go about it?
No, it's the absolute wrong way to go about it, because we're never deficient in arginine or citrulline.
Okay.
And supplements are designed to supplement what's missing or a deficiency.
Mm-hmm.
And these are semi-essential amino acids. We get arginine through the urea cycle. We get it from the breakdown of protein. Same thing for citrulline.
Okay.
And the problem, number one, it provides no benefit. Number two, it can actually provide, put people at risk, and especially in patients who suffered a heart attack. And this was in 2006 in a JAMA paper, Journal of the American Medical Association. They gave post-infarct patients 6 grams of arginine.
Yeah, they wanted to explore that. They wanted to see if that was going to help.
Yeah, they put it to the test. And what they found was that the patients, the group that was getting the arginine, had higher morbidity and higher mortality than the placebo. So it was killing more people than the placebo group. They actually stopped the clinical trial because it was unethical to continue that. And then the same thing happened in patients with peripheral artery disease. Giving high dose arginine, they actually got worse. Because again, if you don't understand the enzymology and the biochemistry of arginine binding to the NOS enzyme and facilitating that reaction, if it's uncoupled, you can produce superoxide instead of nitric oxide. So you're causing and exacerbating oxidative stress, and people get worse. So again, it provides no benefit, and it can provide potential harm. So that's an easy quotient. You avoid arginine or citrulline supplements.
Okay, so for the general dose for overall health, I'm on the right track. I take one lozenge twice daily, or alternatively, I can put you have the product that we're featuring is N101 lozenges, but you also have a sports drink product, which actually tastes quite nice. And if you're going to take something sweet in your bottle with some electrolytes, you might as well take something that supports your nitric oxide. What's that product called?
That's the NO Beats product, but it's a fermented beet powder. We put electrolytes in it. We put mitochondrial ATP, but we position it as a pre-workout or an energy drink because a lot of these kids and athletes are drinking these stimulant-ridden energy products, and it's they're unsafe. I mean, the data out there are pretty clear. So we want to provide a natural source of energy, natural nitric oxide that improves actually cellular energy production, improves circulation. So whether it's the lozenge or the beets, me personally, I start with the beets in the morning because I work out in the mornings, and then I'll pop a lozenge or two, maybe one after lunch in the afternoon, and then one in the evening, or as needed as I need energy. But the good thing about this is you can custom tailor a regimen that works for you, how metabolically active you are, but based simply on the pharmacokinetics and pharmacodynamics of maintaining optimal nitric oxide production. We know that one lozenge in the morning, 12 hours apart, 12 hours later, gives you 24-hour coverage in terms of optimal
Okay.
nitric oxide.
Okay.
Now, if you're more active, you have other issues like metabolic issues or high blood pressure issues or brain fog or mild cognitive impairment, then the demands may be different.
Yes.
You may need more.
I see. Okay. And then finally, again, we're emphasizing the N101 product, the lozenge, but you also have skincare products. So explain, what's the rationale for using nitric oxide releasing products for skin rejuvenation? What's going on there?
Well, the skin is an organ just like any other organ, whether it's the brain, the heart, or the sex organs, and you have to have adequate blood supply to that organ. And so when you don't have a good blood supply or circulation to the skin, you lose collagen, you lose hydration, fine lines and wrinkles appear, and you lose the barrier function of the skin. But the reason I got into skincare was a very personal reason for my dad. My dad's a paraplegic from a car accident in 1984.
Oh, goodness.
So dad's been in a wheelchair for 42 years now. And he battled with decubitus non-healing ulcers.
Yeah,
or wounds,
because he's literally sitting on his skin, and the skin breaks down if you don't move.
That's right, breaks down. And so in 2014, he developed a stage 4 diabetic right ischial ulcer. It was osteonecrosis, osteomyelitis, was septic, almost died. And so once we got him over the infection, obviously the next issue was how do we heal the wound? And in a 60-something-year-old diabetic paraplegic patient, all the wound care docs said, you will never heal this wound.
Yeah.
And I just, as a son, refused to accept that. So I started making a nitric oxide releasing gauze. I'll do a wet to dry dressing usually twice a day on him. And within 6 months, we healed a 4-year-old non-healing wound simply by putting nitric oxide in the wound bed, killing the infection, restoring blood flow, improving circulation, getting tissue granulation, and healed a 4-year-old non-healing wound. Well, then obviously all the wound care docs was like, wow, what did you do? How do we do that? So then to make a commercial product, I had to create a dual chamber nitric oxide delivery system. And so that's the product that we position as a skincare beauty product called N101 nitric oxide activating serum.
I'm holding up.
But yeah, that's a remarkable product.
Yeah, it actually has.
So
it's kind of like it reminds me of epoxy glue. There's like two chambers, so you squeeze one side, squeeze the other, you mix it together, and then some secret chemistry happens, but you can't put those together and keep them together. They have to react.
They have to maintain separation.
Yeah, interesting.
Yeah, so the interesting thing about this product is you can actually see it working right before your eyes, because when you take one pump from each side, you mix it in the palm of your hand, then apply it to your face is going to turn a slight pink.
Uh-huh.
And that pink is due to an increase in blood flow.
Perfusion.
So you don't have to guess if the skincare product is working for you. Yeah, it's opening up the microcirculation, it's recruiting capillaries, it's improving collagen deposition. We've got 6 published clinical trials on that product. And we're developing that same technology for wound care because we've been able to replicate my dad's case in dozens, maybe hundreds of non-healing wounds now. And so that's a product we're developing through the FDA specifically for wound care.
Fantastic. Well, so if people visit HoffmanNO.com, which is the channel that we've established for intelligent medicine listeners with a special offer, they can also access the skincare products. They can access the electrolyte drink as well as the lozenges, right? That's a way to get through.
Yeah. And now we have a nitric oxide friendly toothpaste.
Oh.
Because we've discovered that if you eradicate the bacteria, it decreases nitric oxide production. So we thought, okay, can we improve the diversity of the oral microbiome, improve nitric oxide production, and help circulation? And we can do this through a toothpaste now because we're specifically targeting the oral microbiome. And that's been incredible.
Is that a prebiotic product to some extent?
We put a prebiotic in there. It's a hydroxyapatite-based toothpaste, but we understand the ecology and the conditions in the mouth that these bacteria like and allows them to grow and proliferate. And, we change the pH of the oral microbiome in the cavity. So, using this toothpaste once in the morning, once in the evening has completely, it's revolution. We're starting to hear reports of people getting off their blood pressure medicine.
Okay.
Better dental checkups, less plaque on their gingivitis, periodontal disease. It's incredible.
Okay. So brush your teeth with this product before you eat your arugula salad so that you can fully access the dietary nitrates via the magical conversion that happens for your oral microbiome. That's kind of an interesting concept. But please don't use Listerine mouthwash because that's going to kill everything off. Okay. Great stuff. Boy, always have a fascinating conversation, and thanks for breaking down the science, which is very complex. I wish I could download your brain, maybe in the future, there'll be a computer chip that I could just put in there. But your understanding of these complicated molecular pathways is unparalleled. So, I have a lot of trust and confidence that this is the ultimate nitric oxide delivery system. Visit HoffmanNO.com. That's HoffmanNO.com. Use coupon code Hoffman10 for 10% off N101. And this is one of these products which a lot of times I say, take the product for 6 months and see if you feel different. And so that's kind of an act of faith on the part of my listening audience. But this is a product where I think you'll see tangible benefits in a relatively short span of time, in terms of how you feel, in terms of some of the parameters that actually reflect nitric oxide insufficiency, which is something that we all face as we age. So great stuff. Loving your products. Thank you so much. Keep up the great work, and check in with us periodically, because I know you have ongoing research, and there'll be some new developments on the research front to share with us. Dr. Nathan Bryan, and the website is N101.com, but the offer is through HoffmanNO.com. Thanks for joining us.
Thanks, Dr. Hoffman.
I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant, and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com.